anatomy is very different, and like I said earlier, if a male has a urinary tract infection, you must not just treat the urinary tract infection, you must look for an anatomical change or an anatomical problem in the urinary tract that is contributing to the development of urinary tract infection. If it is young boys, small boys, you think about obstruction at two levels. At the prepuce,
what's that?
That the covering of the penis can stop urine from flowing out well, and that can cause infection. You may see it ballooning when a boy is passing urine. Those boys will mostly present urinary tract infection. The next that you can have is the narrowing of the exit from the glans penis. You have the exit from penis itself. You have a narrowing of that, and that again we need to urinary tract infection. That as a parent you may be able to see. There are other things that you may not be able to see as a parent, the things we call the posterior urethral valves. These are valves of development of the urethra. They are at the level of the prostate, right inside. It's not something you're able to see, and this is something you'll be able to get by taking x-rays that will show you that there is an obstruction. Then you would have even they are anatomical, but they are transient anatomical problems when you have a neurogenic bladder, a bladder that has problem emptying because of the blood supply to it. Either the mass of the bladder is not able to push, or it's pushing against a contracted sphincter. Both ways you have so this child is going to present with infections, and you get a child who has a high fever, young boy who has a high fever must of necessity be investigated for the presence of obstruction, because there must be. You investigate for the UTI, yes, you get to know the bacteria, but even as you treat for the UTI, you must look for the anatomical reason why this child developed.
All right, okay.